All right, let's dive into the world of veterinary eye drugs. From infections to immune conditions, the medications that protect our pets' vision are just an incredible marvel of pharmacology. But have you ever wondered how they actually work? Well, that's what we're here to figure out. We've all seen those little bottles and ointments, right? But what's really going on inside them? How do they do what they do? And maybe most importantly, how do veterinarians choose the exact right one for a specific animal? That's what we're going to break down today. So we're going to kick things off with the most common adversary out there, bacteria. You know the scene. An animal comes in with a red, goopy eye. A bacterial infection is usually the prime suspect. And these drugs, they're the first line of defense. Let's start with a really powerful class of antibacterials called fluoroquinolones. A good way to think about it is that bacteria have different kinds of armor. The older agents like ofloxacin, they're fantastic against what we call gram-negative bacteria. But, as gram-positive bacteria became a bigger issue, a whole new generation, like moxifloxacin, was developed to be way more effective against them. It's this kind of evolution that is just crucial for targeted therapy. Okay, so how are these drugs actually used? Well, there are really two core strategies. Are you defending or are you attacking? Prophylactic dosing is all about defense. You're using drops, say, 3 times a day just to prevent an infection after a surgery or a scratch. But if an infection is already raging, the strategy flips to a full-on attack. That's therapeutic dosing, and the frequency can be cranked up to every single hour to just overwhelm those bacteria. Now, it's not all about fluoroquinolones. There are other really important options. You've got chloramphenicol. It's a broad-spectrum workhorse, but it comes with a serious warning. In rare cases, it can cause bone marrow suppression. Then there's erythromycin. This is an ointment that's especially useful for cats dealing with specific infections like Chlamydophilus fales and mycoplasma. All right, let's shift gears from bacteria to a much, much tougher opponent, fungi. Fungal infections of the cornea, we call it keratomycosis, are a huge problem, especially for horses living in those warm, humid climates. So how do we fight off these fungal invaders? Well, one class of drugs, the polyenes, they launched what is basically a direct assault. Drugs like natamycin, they bind to this key component in the fungal cell wall called ergosterol. This creates a complex that literally punches holes right through the membrane. All the cell's contents leak out, and the fungus dies. It's a really direct and honestly brutal attack. Now, the other major antifungal class, the azoles, they take a totally different approach. Instead of that direct attack, they're what we call synthesis blockers. They work by stopping the fungus from even producing that crucial component, ergosterol, in the first place. Without it, the cell membrane gets all weak and permeable, and you get the same result, cell death. It's just a more indirect but equally powerful strategy. And getting the dose right is absolutely crucial here. For a horse with keratomycosis, a vet might kick things off with a high oral loading dose of a drug like fluconazole. That's 14 milligrams per kilogram. This just gets the drug levels up to where they need to be, fast. And after that, they can switch to a lower daily maintenance dose of 5 milligrams per kilogram. But, and this is a really big one for horses, there's a critical warning that comes with that dosing. Oral azoles like the fluconazole we just talked about can actually interact with common anesthetics. This can cause a horse to have a really prolonged, difficult recovery from anesthesia, so it's definitely something vets have to manage very carefully. Okay, we've covered bacteria and we've covered fungi. Now let's turn our attention to viruses, and we're going to focus specifically on our feline companions. The most common reason for antiviral eye therapy in vet med, it's treating eye diseases caused by feline herpes virus 1. Now, this is a really fundamental concept you've got to grasp. Unlike a lot of antibacterials, antiviral drugs are what we call virus static. That means they stop the virus from replicating, from making more of itself. They are not virucidal, meaning they don't actually kill the virus that's already there. And that right there is exactly why you need frequent dosing, sometimes 5 to 8 times a day, just to keep that viral replication suppressed. So one of the most common oral antivirals for cats is famciclovir, and it has a truly remarkable safety margin. Your typical doses are way lower, but studies have shown it's safe even at a super high dose of 90 milligrams per kilogram 3 times a day. That gives veterinarians a whole lot of confidence when they're prescribing it. But when it comes to antiviral therapy in cats, there is one warning that is truly a matter of life and death. I'm going to read this directly from the source because its importance just cannot be overstated. Acyclovir and valacyclovir should not be administered to cats, orally or topically, due to life-threatening toxicities. kidney, bone marrow. These are common drugs in human medicine, but for cats, they are poison. This is a critical, species-specific contraindication you have to know. Okay, for our final section, we're going to move away from fighting invaders from the outside, and instead we're going to talk about managing the body's own systems. We're talking about drugs that treat conditions like dry eye by modulating the immune system itself. So the condition is officially known as keratoconjunctivitis sicca, or KCS for short. And in a lot of cases, this isn't just about a simple lack of tears. It's actually an immune-mediated disease. The body's own T lymphocytes mistakenly start attacking the very glands that are supposed to produce tears, and that leads to a dry, painful, and inflamed eye. So, the treatment involves something called T-cell inhibitors, like cyclosporine and tacrolimus. These are topical drugs, usually given twice a day, and they work by calming down that misguided immune attack, which lets the tear glands recover. And for really difficult cases, there's even this incredible solution: long-term, surgically implanted cyclosporine devices. They can be used for immune conditions in horses or for dogs with KCS that just don't respond to daily drops. Pretty amazing. Woo, we have covered a lot of ground. So let's take a second and distill this all down to the most crucial, species-specific takeaways that you should really remember from all this. First up, for horses, fungal keratomycosis is the big one to worry about. Treatment's going to involve either those polyenes that directly attack the fungal cell or the azoles that block its synthesis. And critically, remember that oral fluoroquinolones can interact with anesthesia. And for certain immune conditions, those cyclosporine implants can be a game-changing long-term solution. And for cats, feline herpes virus 1 is your primary viral target. Oral famciclovir is a fantastic option with that super high safety margin. Erythromycin ointment is really effective for specific bacterial infections. And the most important point of all, never, under any circumstances, ever administer acyclovir or valacyclovir. When you really boil it all down, effective eye therapy isn't just about picking a random drug. It's all about precision. It's about matching the right drug to the right pathogen in the right species, all while considering their unique physiology and their unique safety profile. And that leaves us with a final thought, doesn't it? This field is always changing. As bacteria develop resistance and new viruses pop up, the therapies we've talked about today are just going to keep on evolving. Which really makes you wonder, what new tools will veterinarians have in the next decade to protect that precious gift of sight?